Forget depression for a moment. Instead, let's think about the flu. You know how you get it. It's a virus. That's the cause. Even so, it has to interact with the specifics of your immune system. Expose 100 people to the flu, some will get it, others not. If you do get it, you will get symptoms: fever, chills, runny nose, coughing. Those symptoms don't make the flu any worse. They are endpoints in a causal chain. The virus causes the infection leads to the symptoms, and that's the end. Okay, back to depression. What causes it? Well, a lot of factors can contribute, and that's not the subject of this course. But let's say we have someone who experiences what I call an intersection. A series of difficult life events, all occurring within a short period of time. She loses her job, a relationship ends, her dog dies, and suddenly her mortgage rate goes up, putting her into financial trouble. Probably she could deal with any one of those factors, even any two, and she could deal with all four of them if they were spread out, but all occurring within a few months. That overwhelms her, and she sinks into a depressive episode. What happens? Well, of course, she develops symptoms. Let's just focus on one of them. Her sleep is disrupted. Normally, she needs 8 hours of sleep. Now she can barely get 5. The insomnia is like a fever in the flu. It's just a symptom. She didn't have it before she had the depression. But there's a difference. Take someone who isn't depressed and disrupt their sleep so that it matches her sleep, and they begin to show signs of depression. It may not be enough to bring on the full depression on its own, but it will disrupt their concentration, make them less interested in doing things, and begin to shift their mood downward. This may make their sleep even worse, and that will bring on even stronger symptoms of depression. So unlike the flu, many of the symptoms of depression are not endpoints. They feed back, and they make the depression worse, which makes the symptoms worse, which makes the depression worse, which makes the symptoms worse. The symptoms become part of a feed-forward mechanism. I call this type of mechanism a snowball. It rolls down the mountain, and it gets bigger as it goes. Or like a forest fire. It starts with a tossed cigarette, but then it feeds on itself. You can find and get rid of the cigarette, but the fire doesn't need it anymore to keep burning, so that doesn't put it out. We could get rid of our person's triggers. Here's your job back. Here's your relationship back. Oh look, your dog isn't dead after all. And here's a raise to deal with your financial problems. This may not get rid of the depression because the symptoms are now driving it. Now, this isn't a course about treatment, but it does give you a hint, doesn't it? Part of the treatment of depression should be to identify the symptoms and treat them, even if they didn't cause the depression in the first place. Fine. What's a reverberation? Well, in a snowball, the disorder causes a symptom which makes the disorder worse, and so on. A reverberation is just a more complicated way of putting it. Individual symptoms can cause individual problems that cause even more problems. Let's go back to the floating diamond for a minute. Imagine our person with an intersection problem. Too many things happening at once. This disrupts her sleep. That's a physiological factor. The poor sleep disrupts her thinking. She can't concentrate. That disrupts her behavior. She can't focus on getting her resume written up. That disrupts her emotions. She's anxious. She won't get another job. That makes it hard to eat, which results in lower energy, which means she can't exercise. And she becomes self-critical for being so lazy, which makes it hard to go out and see her family. In other words, a hit at one point of the diamond influences the next, which influences the next, and so on. the effects reverberate around the person's life. It's like a domino effect. Tip one, and the next one tips, and so on. This too makes depression particularly challenging to treat. As a matter of fact, it makes it sound almost impossible. Luckily, it isn't. Most depressions resolve on their own eventually. But if we find specific things to change, even a little bit, the reverberation can begin cycling back the other way. With this client, we might invite her to give up on finishing the resume, but spend 5 minutes writing down the changes she needs to make on it. Having succeeded at that, she's a bit less anxious, so she can eat a little bit more, and she has a bit of energy to exercise a bit, and the feed-forward mechanism begins working the other way. This is how most depressive episodes eventually resolve. With help, a person can speed up that process.